No, use your right hand.
When you're 6 years old and your hand just stops working, you compensate.
I noticed she had the pencil in her left hand. And knowing she's not left-handed, I said, "What are you doing?" And I said, "Put the pencil in your right hand," and she told me she couldn't. And when I handed her the pencil, she grasped it like this. And when she went to write, it took her entire arm to make her hand move.
Perfectly healthy first grader Erica Wilcox says it all started with a fizziness in her right hand. And by the end of the day, she couldn't write or even get dressed.
Ready? Choke up a little bit.
Dan took her to the emergency room and gave me a call that they were going to admit her.
Initially, Erica was diagnosed with a brain tumor, but after more testing, it was determined that she had a stroke due to a rare brain disease called Moyamoya.
The fundamental problem with Moyamoya is an inadequate blood supply to the brain. So surgically, we need to correct improve the blood supply to the brain.
Patients with Moyamoya will have additional strokes or brain hemorrhages as the disease progresses, so a pair of surgeries, one for each side of the brain, was Erica's only option.
Predominantly, the method used in children is to do what's called an EDAMS operation. And there's a large chewing muscle that's present on the side of our head, and we simply just free up that chewing muscle and just lay that muscle on the surface of the brain.
The brain signals the muscle to create new arteries. Erica's brain gets the blood it needs, and the risk of stroke diminishes.
About 2 weeks post the second surgery, she came to us and said, "Mommy, the tingling is gone." And she's favoring her right hand again.
Just over a month after her last surgery, Erica is back to her old self again. She's still working on gaining that strength in her hand, but once fall comes around, she'll be allowed to play outside with her friends again and participate in gym class. At Cleveland Clinic, I'm Erica Foreman.